Hi, good morning and welcome to Preparation Meets Opportunity. We're so glad that you could join us today to learn about some promising practices between a CBO and a community college partner. That partner today is the Borough of Manhattan Community College Department of Continuing Education. The CBO is Comprehensive Youth Development. For over 25 years, we've been doing programming with the older youth in New York City and high schools, preparing them for college and career. And in 2013, we started working with employers and Jobs First New York to build a sector-based initiative that was employer-driven to try and create a certification pathway for young people to work that not only gave them skills and a job, but a career path. You may know us as CDI, Comprehensive Development Inc., but we are now formally Comprehensive Youth Development. So thank you for joining us. And we are very lucky to have a very gifted person who was at the beginning of this with us from the Aspen Institute, Sheila McGuire, to be our moderator today. And I'll turn it over to Sheila.
Thank you, Michael. And you'll forgive me if I occasionally say CDI, but thank you. I'm so honored today to facilitate a conversation about how the work of a partnership between the Borough of Manhattan Community College, CYD, and Northwell Health, as well as other employees and stakeholders, have resulted in strong outcomes, not only for young people, but with enhanced employer engagement. So on both sides of this equation. The idea that services could be improved by community colleges, CBOs, and employers working more closely together is not a new one. It's been around for a few decades, and it's been documented by the Aspen Institute and by many others. A model, somewhat like we're going to hear about today, has taken hold in some places, with CBOs, employers, community colleges, all playing different roles to deliver career pathway services in target industries. But it does not reach significant scale. These partnerships are challenging, and I think they're challenging for a number of reasons. When very different types of institutions really have to collaborate together, it's different funding policies, different staffing patterns, different organizational structures, different outcomes. All of these differences between the institutions that are collaborating have to be overcome. And so we're very lucky, and I really feel this very strongly, we're very lucky to hear from some people today who've managed to make this work. And make it work well and have a vision for how they can grow it. And so that's what we're going to hear about today. I'm particularly pleased or heartened, I have to say. And in these times that we're living in, being heartened is something very valuable to us, I think. I'm very heartened by the work that has gone on in this particular partnership. I began the work with CYD with my work with Jobs First a good number of years ago, where Jobs First sponsored the Young Adult Sectoral Employment Project, and we will hear from Marjorie, of course, today, and to really figure out how can sectoral employment programs that had gained considerable momentum in the adult field really be adapted to deal with young people and in the young adult field? How can a more employer-aligned approach work? So the lessons that we will hear today have come from some intentional planning, moving to private funding, moving to integrating into the public system and bringing public funding to the table. So I really do think that the lessons that we're going to be informed of today can help guide how we rethink and how we rethink the delivery of services to young people. And never really has there been a more important time to do this, where we're in a moment of flux, where there is both the opportunity for great change because the status quo has changed considerably, but there's also great perils for young people who have been significantly left behind over many, many years, that they will fall further behind. And I think what we'll learn today will help us think about those in new ways at the systems level. The way we've got the agenda organized is that Michael's going to give us an overview first of the program, the promising practices, the structure, to give us kind of a common grounding. And then we're really pleased to be joined by our panel, Sunil Gupta, who has led the effort over the past 6 years on the behalf of Borough Manhattan Community College and led the effort in terms of the collaboration. Deirdre Duke, who has brought her deep experience in human resources, particularly in the healthcare field, to help with the design and delivery of the programming that we're going to hear about. And then last Marjorie Parker, who is the President and CEO of Jobs First NYC, and we'll look at how what makes this an effective model and how we can build systems. We're going to do 2 rounds. The first round, we're going to kind of think about how the program works and what does it look like and get our minds in that. And then the second round, we're going to say, what will it take to grow? Where are the opportunities for growth? And we're going to hear from the panelists on that. Then we will move into a Q&A from you. We've reserved some time at the end for Q&A for you. And we also have the Q&A open for you to chat in questions that will then come into consideration. We will then take some of those questions and ask those at the end. So that is our plan for our time together. And with no more delay, let me turn it back over to Michael to give us an overview of the program.
Thank you, Sheila. So I want to walk you through the Career Academy programming and some of the promising practices that were discussed. We're working with 16 to 24-year-olds, and our programming at the Career Academy is for 18 to 24-year-olds, but we know that work has to start earlier. So CYD for years has been looking at that for over 25 years. Next slide. You can go to the next slide for me, Maria. And here are the themes that we're talking about today, and thanks to Jobs First New York's report, The Early Impact of COVID-19 on Young Adult Workforce Development, that they put out in May 2020, Insights into the Field. These themes resonated with us for many years, but they've become even more prominent in this situation. Young adults will be at the back of the employment line, which is true. We've always seen that with 18 to 24-year-olds, but it will be even more difficult with the new economy that's coming out and so many people out of jobs. Skills and competencies. Never in the history of this country has it become more important that our kids are not just getting a job, but building skills and career pathways to long-term employment. Work-based learning is at risk. Just recently, the Learning to Work programs were cut 25% at the Department of Education from the mayor's office. And so we already know that is happening, and we have to save those resources. Barriers are more interconnected than ever, making partnerships even more critical. So the partnership we're going to speak about today gives some promising practices for how others can do that across sectors, across departments, across different areas of education and non-for-profits. The New York City system has always been erratic with how to manage this programming. We've seen a lot of beginnings, but not a lot of finishing. Some systems built, some not completed. But more than ever, the city is going to have to work in partnership with private and citizens and our young people, as well as our educational department, on how do we really create a system of workforce development that really helps our young people go forward. The next thing I'd like you to look at is the Career Academy model. So some people know it, some people have not heard about it, but it's a very unique way of preparing kids for workforce training. We are looking at outreach and recruitment being a program component, and that should take time. We're also building a bridge. And so people call it core readiness, some people call it essential skills or soft skills. But this is the program to get their workforce skills together. But more than ever, we learned they need a clearer introduction into the sector they're entering. Before that, they may enter a certification program, but not really understand the industry or role they're going to play. And so we partnered with Primary Care Development Corporation to help build that. The occupational program has included medical assistant training, medical coding and billing, as well as EMT over the last 7 years. We've tweaked those programs. Sunil and his team have really worked with us. We have a great medical assistant program that includes medical coding and billing, so that you have an administrative and clinical arm, which gives a little more diversity in hiring. But that takes a lot of time, and we'll talk about some of the practices there. Also, it includes an internship. The fourth component is job placement. And we realized in year 2 of the program that this is where most certification and occupational training programs are failing. We put all of our resources into the training and development, but The employment work is, you get 1 or 2 chances to interview. This had to be much more rigorous. And we were lucky that Pinkerton Foundation helped us create a job resiliency program where we hired an employment coordinator who really helped build bridges to employers, as well as assist kids on a journey that can take 6 months to a year, sometimes longer. In our next slide, you'll see what our promising practices are in our design. And these, I think, have really been what has made this program work for 7 years. Right now, we are the only CUNY CBO partnership still operating this way, which we began 7 years ago, which I'm very proud to say. And this is why. We are integrated on site. And so we made a decision very quickly to have the programming at the MCC so that young people get a chance to be exposed to college life and an adult education environment. Our students move in a cohort. 25 students move at one time to build support networks along this journey, from the beginning all the way through occupation and internships. Cross-training of our CBOs and our college partners. We had a lot to learn from each other. We're not college folks. They weren't particularly youth development folks or clinicians. And so we helped each other understand practices that would support students in retention and completion. Continual evaluation and modification. This is really key. And it wasn't yearly or monthly. It was almost every 2 weeks that our staffs meet and discuss what they're learning and try and make those changes as soon as possible so that we can have the best results. Commitment from leadership. We were told at the beginning of designing this model that it had to be from the top down, from our boards all the way through, that everybody had to be committed. And Sunil and I have had that through the whole 7-year journey. We continue to meet and develop and keep our stakeholders invested in the project. Creation of a shared culture, very important. So no one knows everything. And so we had to share together how to build an environment that supported young people and also supported the adult education environment, which we were able to do successfully. It takes a team. And you can see from this list how many partners we've had, from employers to the schools, to trainers like Primary Care Development Corporation, Northwell Health, the Workforce One healthcare centers, have all been part of building this model over the last several years. The first promising practice is engaging and retaining students. We realized that a lot of programs are built to X kids out and not to include them. And so together we started looking at the entrance exam and how we could get kids in, and thanks to the flexibility, our TABE exams that kind of test English and math and reading, we were able to use that as a baseline and then build those skills in the bridge with students. And because of that, 90% of them were able to complete the bridge program and have an opportunity to interview for occupation. Next slide. 2, preparation and readiness. CBOs have to have a bridge. And so someone asked me why this has worked and it hadn't worked in other models. We really commit to this 8-week bridge of readiness, and it gives the young people a chance to decide if they want to go on occupation. We look at their readiness. If they can go on, they can get support and remediation services. 3, we're looking at occupational training support. So we learned in the first year that we were just going to hand our students off to BMCC after we did our bridge and our recruitment. And then we realized that they needed support throughout the occupational program. And so thanks to foundations like Cummings, Pinkerton, Tiger, Robin, a bunch of folks over the years have helped us provide that resource to get study, skill workshops going, tutors in, trainers in. And why was that important? What we didn't realize was we were asking a group of kids that were already behind educationally to learn higher educational values and skills in a very quick turnaround of time. We're talking maybe 3 months. And so we really needed to support them through that, like most kids have to do in their freshman year of college. 4, simulation training and internships. You know, the practical application of certification training is what makes it different than just a regular college program. Not only are we asking kids to learn skills really quick, we're asking them to demonstrate them in a very quick and proficient way. And so the simulation training and the internships really help kids get hand-on real world feedback that allows them to be prepared to connect to those jobs. 5, Employment support. Again, as I said at the beginning, employment is a program piece like recruitment is. And you have to have someone that is not only engaging students, building their resiliency. We've all looked for jobs, right? And we don't get the first, second, or third. But how do you keep moving and staying motivated and learning skills and taking that feedback from each interview and building yourself, especially when for many of our young people, these are their first interviews. So we have built that into our program, and I would say that's a promising practice, but essential to getting to the outcome that everybody wants, which is students being employed for a year. Because in honesty, post-COVID, this will take even longer. Lastly, I want to just talk about the outcomes really quick. The cost per student has ranged from $8,000 to $10,000 a year. We are partnered with the Department of Youth and Community Development, which gives money, but it doesn't cover everything. It's an 80% contract for program, 20% for follow-up. And so luckily we've had partners, private funding that has helped us really do a more quality program for our young people. And that I see continuing on, that those partnerships have to be there in place. Total enrolled so far is about 285. Completed the bridge program, as I said, very high, 92% of students. Where you will see a decrease is in occupation. It goes down to 68%, sometimes 70%. And that's where we find students have been having the hardest time educationally. And over the last 2 years, we've seen more of that with our change to city contracts, where we're getting a more deficient population. And so we've been building the training, occupational support even more as we go forward. Once they're through that, completing internships, 90% of the students will get through. And employment has been pretty good. It has ranged from 65 to 78% for us. The students right now, we're at 78% for those that have completed the full model. So there are opportunities there for them. Lastly, and thank you, we are going forward. We realize we have to educate our high school students earlier and do skill-based training at the high school level, not just career awareness. It's not going to be enough post-COVID. Developing skill-based programs are essential to our young people navigating this economy. Determining the scalability of the model, we've been refining that and looking at it. We do think it's $8,000 to $10,000. We also know they have to work in small cohorts. So you can't just do 100 kids at one time. You also have the right staffing. Right now we have 3 full-time staff, 2 part-timers, and at any given time, they're managing 100 students, from internship to bridge to occupation to employment. And we have to keep growing our public and private funding partnerships, knowing that one funding level will not do it. We have to kind of combine our resources to do the best for our kids. So that's the big picture. Hope I didn't go too fast, but I want to use our hour properly. And I want to get to the panelists because we can talk more about this in depth.
Great. Thank you, Michael. We're going to go first to Sunil. Sunil, as you think about the partnership that you've been engaged with over the past 6 years, what is the importance of that for you in terms of the Borough of Manhattan Community College and its workforce programming? Why is this type of collaboration important?
Thank you, Sheila, and good afternoon, everyone. And I want to thank Michael for so effectively and accurately summarizing our 7-year relationship. And that was very, very accurate. Thanks.
Not easy to do it.
and on to the question. The importance of a partnership with a CBO like CYD is that it really creates an effective mechanism for higher education institutions to leverage services through multiple streams of braided funding for our communities. And this is more important, particularly today when we see a majority of institutions like our own does not have the ability to provide such comprehensive wraparound services. Together, colleges and CBOs can provide these more effective, intrusive, complex services to our target communities. And this kind of strategy, though it may sound simple, is very effective. Not one institution or one CBO can be all things to all our students and to our communities. More importantly, every stakeholder in this partnership plays a critical role, and it is important to align these partnerships also that they're based upon an organizational set of values and missions, and that they must align. And that was, as Michael indicated, was something early on that both Michael and I found out, that we both shared the same philosophy and focus on students, that we didn't look at our students and the people we serve as coming to us and we didn't look at it as a deficit mindset, right? We really looked at where they were coming from and what they brought with them. And that is particularly important because the partnership decisions that come out of this really are rooted back in our mission and our vision as an organization for both the college and the CBO. In our long-term relationship with CYD, we found that our vision and values were clearly aligned. And the alignment that both BMCC and CYD found common ground was that we both looked upon our students as coming with some cultural collateral, and it was valued, but they didn't know how to navigate the very complex and bureaucratic mechanisms of higher education and academia. And understanding that, we started to see how we could further enlighten the students, guide them, and also provide this kind of comprehensive safety net where one partner started and where the other partner ended was a blurred line. And we worked together to support our students. And although we've had numerous partnerships with many other excellent New York City CBO partners, our partnership with CYD still remains our best, brightest, and most unique and effective relationship. Primarily because, as you saw in Michael's presentation, the ability to embed the CBO partner into our programs, literally, physically as well, meant that there was no delay and there was no passing of the buck, so to speak, in which intervention was the CBO, but academic issues was the college. There was a gathering where students felt that when they came to either the college or the CBO partner, it was being looked at holistically. And I can't emphasize how important that has been for this relationship. Further, we cannot forget that the current environmental issues that are plaguing higher ed make this very important, these type of partnerships, particularly today. Our higher ed institutions, particularly community colleges, are facing lower enrollments nationally due to many factors, but primarily due to shifting demographics. And this is even further compounded by the economic crisis we find ourselves in today. The importance to engage with CBO partners like CYD is critical. And our communities that we serve really deserve these sort of innovative practices. And it is not something that is easily done, but once it's done, it can be sustaining. As you can tell, it's been 7 years, and it's not been just one funding source, as Michael had indicated. We've gone through multiple initiatives where either we were looking for funding or Michael and his CBO were looking for funding. So we've been able to keep it going. And clearly the importance of partnering with our CBO partners like CYD has an impact on workforce programming. This is where higher educational institutions and CBOs can play a critical role in striving to protect the equity of our education and workforce development responses to our communities. We need to work even closer than before with our local community-based organizations in an effort for our shared leadership to creatively find and continue to seek out and leverage any available funding to provide the supports that our students really deserve. We have to continue to work closely with local employers who are shifting their focus and employment needs, and we must continue to stay aligned with federal, state, and city initiatives so that we can continue to support these key sectors, both in their contingency and long-term recovery plans for the city of New York. I mean, and that's a big part of where we have to keep our eye on the ball. There is a fundamental role for workforce development in New York City to play, along with the city, state agencies, in shaping the future. And it's got to be more equitable by working together with partners like CYD, and to build these partnerships that can leverage existing workforce training initiatives. And this type of partnership is critical because it provides an opportunity to change the prevalent culture that exists in higher educational institutions. And that has been, if I had to identify what was more difficult, I would say that would be in the top two. Certainly job skills training, getting them employed, getting them prepared for the 21st century job skills. But the cultural change and the climate change in higher ed has been a difficult one to do. And it is happening, certainly with the adoption of guided pathways, in which BMCC is a key player in CUNY in that modality. It is taking time to change that mindset of our faculty and how they look at students. And these pathways that may seem to some faculty as being alternatives to education are really interventions that support education and student success.
Exactly.
And then finally, I'd like to say, it is imperative to understand that our students uh, both our students from the CBO perspective and the higher ed perspective, continue to need high quality training programs and support. And these partnerships can be the perfect conduit to engage our students in these career pathway programs. And unfortunately, though we may have vision and we have planning, the reality is, a vision without funding is a hallucination. And that is kind of the biggest challenge we're facing today, in addition to all the other things that Michael had indicated.
Thank you, Sunil. That gives us a lot of fodder as we start thinking about the growth of a model like this. Great. Deirdre, now we'd love to go to you next and hear a little bit about why Northwell Health is at the table here, and what are some of the takeaways that you've gained from this work in this partnership, and how do you think about it? How do you think about the importance of this kind of partnership to your organization?
Northwell Health is the largest employer in New York State, and our mission is to provide the best care, the best clinical care to our community. And we do that through the people that work, the 74,000 people that work for the health system. It's very important for us in terms of our mission to provide culturally competent care and to have a diverse, inclusive workforce that reflects the community and the clients and the patients and the customers that we serve. The thing that is most meaningful about our partnership, with the school and with the CBO, CYD, is that when you're looking at the workforce system and trying to design it, it's important to, in terms of quality and process improvement, to design it with the goal or the end in mind, and in this case, that's employment. So to have a partnership like this, where you have the opportunity from end to end to design the workforce development system, something that's either sector specific, because the healthcare sector is a #1 growing sector, or something that's job specific, is that you can really align all of the moving parts, so to speak, and have a certain unique synergy that creates a higher level of success. The jobs look different from the outside in. The healthcare industry looks different from the outside in. Many people think that have a hospital-centric perception of healthcare, that oh no, it's not for me because I can't stand the sight of blood, or I don't want to be around sick people. Here are different misperceptions of the healthcare industry. The largest growth in healthcare is in the ambulatory outpatient care sector and in the home care sector. Although we'll always need nurses and we'll always need certain jobs, there are many other jobs, including IT jobs, that X-ray technology, it takes a village to run a hospital, anything for support services, food services, EMTs, they're all critically important. And as healthcare transforms to value-based reimbursement scheme and care, and as people get older and continue to age, we have an increasing need for jobs in medical offices, home care, ambulatory care, a huge 800 ambulatory sites, in addition to our 19 hospitals. So the partnership really helps us all have an understanding of the competencies that are really required to succeed in the role, not just the occupational skills, but also the soft skills, communication, teamwork, resilience, adaptability. These are all very important in the workforce of the future, not to mention all the technology changes, and in healthcare in particular, technology is changing and advancing at a rapid pace. We see this during COVID with the rapid adoption of telehealth and different types of services. Even in our EMT and our ambulances, we have a computer where you can pull up an interpreter to speak to the patient in any language as the patient is being transported in the ambulance. So even our EMTs, they have a lot of equipment, have to deal with all kinds of technology skills. So in order to design an effective workforce development program, in my opinion, you have to start at the end and design it backwards. And you have to include all of the stakeholders so that everybody has the same information and the program can be designed to be successful. And to me, success is gainful employment. Once you start working for Northwell Health, we pay well. You have access to either union or non-union tuition. You have exposure to a career path where you can take the next step in your career. Michael knows and Sunil knows, Marjorie, because we've spoken about this, that many of the senior executives in Northwell Health started out as a field EMT. And they work their way up. They run the hospital. They run huge divisions. And we have many success stories. I have a vice president of a cardiac surgical line that started out as a per diem ward secretary on a floor, you know, picking up doctor's orders and entering things into the computer. So once you get into an employment with a healthcare employer, we have a corporate academy, we have leadership development, we have all kinds of internal development programs. I just did an apprenticeship for a hard to fill job. With incumbents, but we could easily do those things also with outside candidates. So I think employer involvement and the alignment of all of the stakeholders in the workforce development system working together, and we're not just passing the baton. We have a shared commitment, and we're constantly able to give each other feedback about program design and implementation and execution, and have an environment of continuous improvement. So if we even do a pilot program involving a job or a classification of jobs, we know that once we've done it once, the next time is going to be even better. And that's very important when you're designing workforce programs. You have to have repetition. You have to have a chance to do a pilot. And then you have to take that feedback and you have to improve the system going forward, which gives you increasingly better outcomes.
Great, thank you so much.
Can I say thanks to Deidre? We have many EMTs out that have been in the front of COVID. Shout out from me because I'm just proud of them. But it's been fantastic to see what you've done with them.
But it's the raw talented potential. I have to say at the front end, just also very quickly, that it can't just be, it's got to be a good job person match. This holds true for all types of recruitment and hiring, and more so in terms of workforce development. But when you're putting $8,000 or $10,000, whatever it might be, into each student to help them develop and land that first job, you're opening up an everlasting, and we're all passionate about this, wealth of opportunity for them to step out of poverty, to step out of the hardship that they've had, and to work as part of a team with other healthcare providers or whatever industry they're in a supportive, learning, nurturing environment, which is going to make a lifelong impact on them financially, emotionally. The confidence that they get from that first step of getting through that first program and getting that gainful job and employment gives people such great hope and great boost to their self-esteem. And then from there, they have such confidence. They're going to stay in that job for a while, but they might just go up and up and up and up. And it's completely transformative. And we all of us have great commitment and passion, which is why I think this program and this partnership works, because we have shared visions, shared goals, and we're so collaborative.
Great, thank you. Marjorie, we're going to go to you now. And in your role at Jobs First NYC, you get to look at the citywide system and structure. So share with a little with us about what makes this model effective, and what do we need to do to build the systems that support it? And you're muted. You need to unmute.
I do that to keep the going. Thank you. I know. Thank you, Sheila, Michael, and your team for really inviting Jobs First to share, how we partner with you to work on the CYD Academy. And Deidre and Sunil, I learn something new every time I listen to you, and I end up taking a lot of notes. As many of you know, Jobs First, we focus on creating and advancing solutions that break down the barriers and transform the systems across the city that support young adults and their communities in the pursuit of economic opportunities. And we believe building strong, more impactful collaboration comes through partnerships and collaborations. I want to give Sheila just a little bit of background on the status of ASAP today, because I think it's important that we understand that, and a little bit of context around the YASA, because I think it's also important to understand why CYD is more successful than some of the other partnerships that were launched, not by Jobs First. YASA was replicated by the City of New York and the model was adapted across some of the colleges and nonprofits. You know, right now, between about 259,000 and 324,000 young adults are out of school and out of work. That's an astounding 27 to 34%. And just for context, prior to COVID, that number was about 129,000. The data on the early pandemic job losses indicates that about 35% of young adults lost work. So that's higher than the citywide average. Few things that we know right now is that enrollment in community colleges has dropped by 23%. And we've also seen drastic cuts in public funding for programs serving young people deemed at risk in school. What we know for sure, for those of us who work in this space, trying to find solutions for young people who are out of work and out of schools, that these numbers will stay stagnant for a while and they'll continue to grow for a while given these conditions. Now, you know, for the CYD Career Academy, so Michael and his team developed the academy through the YASEP program. So YASEP is one of Jobs First Work solution, which identify, design, and advance practice and policies that achieve better outcomes for workers and for employers. And Deidre talked about this a little bit. So it brought together a community of employers, training providers, and other stakeholders, which both Sunil and DYC and Deidre talk about, with an explicit focus on what's happening with the labor market, what do employers need? And employers were at the table articulating what they need from a program like YASEP to make this work, and to start with the end in mind, which is what Deidre said. So the CYD Academy is one of the 10 sector projects that came out of the YASEP program. We think the secret sauce was something that no one wants to talk about. Is it was 1 year of learning together. So asking employers and colleges and CBOs to spend a year together. And I have to admit, Deidre, initially, and Sheila knows this, the employers said, yes, we want to be a part of it, but you want us to show up once a month or something? We don't have time for that. But the commitment that they made, and they recognized that they had to make, was that if you want something different to really meet your needs, then you need to participate in the building of that thing. So YASEP launched 10 partnerships. So I think that through March 2020, 3,000 young adults have been served through YASEP, right? And it's just really impressive when you look at what CYD has done with the project. And it was the first demonstration project in the nation, as you said, Sheila, to really test the effectiveness of adapting sector practice for young adults to produce better outcomes. CYD Career Academy is the proof that that strategy works. So, what we're looking at is, you have to utilize a comprehensive collaborative approach that enables these longer runways and stronger pipelines, right? So in other words, enough time and preparation for young adults to master the competencies necessary for success in the workplace, and then sufficient employee input to ensure that participants who are completing training programs are ready to contribute from the first day on the job. And so that's really across the city, Sheila, this has been adopted. It has worked well in some places. As Michael said, and Sunil will confirm, this model was replicated across the city. Some of it worked really well, some of it did not, because it really missed that missing piece, which was you need a consistent relationship, transparent relationship, common understanding around asset, not a deficit approach, right? But an asset-focused approach to really make this work. And I'm going to stop there because I know we have a lot to talk about.
Great. So one of the interesting, I meant to say this earlier, but I'm going to get it in now. One of the interesting colleges really taken this somewhat to scale is the Northern Virginia Community College, where our soon-to-be First Lady, Dr. Jill Biden, is serving. And I do feel that there are really some opportunities not to be naively optimistic, but to say there's real learnings and real relationships and real things that could happen with our work together. So what we'd like to do is take a few moments and kind of do and we'll make it a lightning-ish round. You know, we've got about 15 minutes left of our time together to say, where do you see the opportunities? Where concretely do you say, let's pay attention to this? Here's a chance to grow. And we know resources are a huge part of it. And we know we need to figure out how we address the resource issue, because $10,000 is a very small amount. And what we know from the research about youth employment programs is too little, too late is not going to help. Like, the level of investment counts. And as we can hear from our panelists today, the level of coordination and intensity of services counts. So I'm going to start with you, Michael. Where do you see real opportunities for growth in this program?
I'm excited that one, it can be replicated. Ourselves, we can take it further to scale to replicate more training tracks with Sunil. We've talked about technology, using the same practice principles for other sectors. So I think there's a great opportunity there. We want to engage more males, right? And so the healthcare, our EMT probably engaged the most males. Our medical assistant is still about 85% female. So we're always challenging ourselves with our Black and brown young men, how to get them engaged into healthcare and sectors. So X-ray technician, technologies, might be an area of growth for us with resources. The other place that I think for the city of New York, the Department of Education has to make room for skill-based training and vocation in our high schools.
Yes.
A lot of people would hire them out of high school in the technology field, coding and help desk work. These are things that young people could be learning and actually come out with a certification in partnership with the Department of Education. Almost like at the college level, you can get a certification in your AA. You get your high school diploma and a certification in something, where you can go to skill-based jobs. And why is it imperative? Retail is going to have a hard time coming back right now. Food services, movie theaters, these are the places a lot of our underprivileged families start working when they come out or manage going to school. That's not going to be available in a large volume going forward. So our work as CBOs is going to be to educate our young people on this new economy and why preparation, using this time to invest in your skill development, is so important to your long-term outcome for employment and career trajectory. So that's where I think there's a lot of opportunity, and where we can really get some great outcomes.
Sunil, where do you see that opportunity from your vantage point?
You know, I think there's tremendous opportunity, you know, in the face of all the adversity we're facing in New York, primarily in the expansion of these bridge programs, and further with the tipping point of the academic culture that's changing based on lack of enrollments, other issues. It is imperative that we start to look at new instruments that are being developed and tested in CUNY and nationwide. One of them is the use of micro-credentials. And that is a rapid attachment type of mechanism that does carry maybe one or two stackable credentials, highly effective. It's only one instrument, but one that could be really good for youth and that would work great with our relationship with CYD in the sense that it could be the mechanism to engage students for the first time in how they enter into higher education. In addition to that, a very useful item, again, that CUNY is focused on highly now, is the use of credit for prior learning. There is a sincere and genuine effort on the CUNY university system as a whole, and their board of trustees had passed a resolution for the very first time to take an inventory of all of such programming based on the CALE model and various other models of competency, you know, employer-based skills, and then to develop some kind of mechanism to transform that straw, so to speak, into gold, which is credit, and not just gen ed credit or elective credit, which is not only not useful, but actually detrimental to students because they accumulate too much credit that doesn't lead to their focus major or their career goals. And so I think that taking all of those pieces, they're all happening simultaneously. But more importantly, the partnership aspect which is critical in this formula to generate and to identify where our populations of need are in the city. And so I think all of that together is part of that recipe of how this could get to scale and more expanded.
Right.
Can I piggyback on one thing? Because I want to make something clear about the young people we're serving. when you look at private and government funding, the flexibility has been in the private funding to allow students who are most interested to come to these programs. Our government still has a lot to do in looking at not making poverty the only indicator to join these programs. And a lot of their levels of poverty are based on 1972. And so it X's out a lot of students that would be more ready for these programs that with a little bump can go a far way. And so that's an advocacy issue that we've tried to take on, but that has got to change. And we can't offer programming just by your poverty index. And when I say poverty, it's not even low income. I'm talking almost at the homeless level, living in a shelter, as the only population that we're serving through the city of New York in these types of programs. We have to have a wider range, and then we will get a better workforce outcome because you'll get more ready students who can complete these programs.
Right, right. So Neil, I'm very interested too. You mentioned the issue of how you create a different sort of culture in terms of partnership and how you see the opportunities for that, how you see that happening.
Sure, Sheila, I just want to clarify, it certainly wasn't just me. I mean, the inertia started with our institution and our college leadership being part of the AACC, American Association of Community Colleges, and the Aspen Institute's focus on guided pathways.
Yes.
Being selected to participate and then being involved in it, it was a 3-year process. And again, if you know guided pathways, it's never completed. It's an ongoing frenetic kind of energy in which we took and mapped 81 different separate majors and made 8 different career and academic communities. And now that we have that blueprint, we are ready, and still a long way there, to start to integrate these stackable credentials or these micro credentials as one of the conduits into the learning communities. And then the dual enrollment model with the Department of Education is also a critical role in this formula, but also the partnership with the CBOs, because as Michael indicated, many of the high schools are not quite there yet. I mean, there's some that are focused on it, but what the CBO partner brings is that expertise and those wraparound services that for us as a division within a college is very hard. And for those who are not familiar with the ACE divisions, fondly known as Adult Continuing Education Division in the CUNY system, they're all self-sustaining. They do not get replenished budgets from the city or state. In fact, they have to attest that they generate their own income, contract training, grants to sustain themselves. And so with all of that, the value and the need for these partnerships is critical.
Thank you. Deidre, let's bring you in. Where do you see opportunities for this growth, the growth of this kind of approach?
I think that, there's healthcare is going to continue to grow, as I said, and it'll be across the continuum of care, including outpatient as well as inpatient home care. And there's a whole classification of jobs, very good jobs, where a person can enter into the sector without having to incur college debt. Technical jobs, Michael, I had mentioned, a number of jobs to CDI also in terms of CYD, like Central Sterile Instrument Processing Technician, which I just did an apprenticeship for because we had an occupational shortage. So this whole level of jobs that do not require an academic degree, that with a relatively short cycle of training, both academic training and also work-based training, individuals can get jobs that pay $40,000 a year more, plus benefits, plus access to tuition, and that whole career path. So I think that it goes back to grade school and it goes back to high school, that young adults need, increasing exposure to all the different careers that exist out there in the healthcare sector, even community health workers, which are a group of individuals that visit patients in their home and help them deal with barriers to accessing healthcare, food insecurity, housing, transportation. Bronx, Lebanon had a CHW program. We did one that was funded, and we recruited people from bodegas, from unemployment, and because there are certain roles where it is more effective to have people that are bilingual and trilingual and at the same culture of the patients in the underserved areas that you want to help have better health and better access to healthcare. So I think that it's a matter of, again, getting together and understanding the demographics that the CBO population serves, and then aligning with the academic and the bridge programs and the preparation, because people do need a certain amount of literacy, both digital literacy and literacy, literacy in terms of language. But there's, having bilingual and a multicultural workforce is an enhancement to serving the community and an enhancement to having more effective care teams in the healthcare system. So we recognize that, and we have so many different opportunities at the entry level up to physician and everything in between, and not just direct patient care. So I think it's very important to give people hope, and for them to be able to have exposure to all the different careers, because if they just look at what is put in front of them otherwise, it's very daunting and discouraging. And what you want young people to have is hope and encouragement.
Great, great. Marjorie, from your perch at the city level, where do you see opportunities for change, for growth of this approach?
Thanks, Sheila. I know we have some questions, so I'm going to keep this very short. I echo Michael and Deidre and Sunil around building stronger bridge programs. I think this time, longer runways and stronger pipelines, what I mentioned before, I think, CYD is a career pathway program. Deidre likes to say disruption breeds innovation. That's, it resonates with me when she says it. The Young Adult Sectoral Employment Project was a disruptive opportunity for us that really produced a CYD or Per Scholar's Tech Bridge program, for example, and several others across the city. I think we have an opportunity to replicate and scale out some of this effort, given that we have the right ingredients for what we know now can be scalable and can be effective over time. So that's the opportunity here.
So turning to some of the questions from our attendees today, can you tell us a little bit more about the financial needs of these programs and the streams available, and the way they supplement each other, as you think particularly about that in the future? Who would like to talk a little bit about the financial structure and the way the funding streams work here?
I can talk a little from our perspective, and I'm sure Marjorie can talk from a larger perspective. I think the components of training cost money, right? And so government gives its own amount. And I'll be even more specific. CYD, who is our partner, has given over $500,000 to the programming, but it breaks out into 80% for the program year, 20% for the follow-up and employment follow-up. So that money scales down. You have 3 full-time staff, 2 part-timers. You're managing 50 students per contract year, plus the 50 you're following and doing employment with. So that money disappears very quickly. We also have to pay our occupational partners out of that money. So BMCC, Primary Care Development Corporation. So as you see, the money for support is going down, 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 as we're getting our technical costs covered and things like that. Then the wraparound supports are intense because of the educational remediation people need, the barriers work. So when we talk about barriers, it's not just to assess that you're homeless, we're helping you look for housing, that you need daycare to be in the program. So those support services, you need experts, you need an MSW. So the cost becomes larger. And then the employment piece itself is a cost that people don't even really figure in to the overall grants. It's kind of like, well, you did the training, so the outcome is employment, but there's no real money crafted for it. And that's where the private partnerships have helped us. We've been able to go to people and say, this is the need. Can you help us do a more quality program to help these students? And people have been generous to come up and support us. It's been different people at different times, but that becomes its own effort for leadership to keep those resources going and keep the quality up. Marjorie, what are your thoughts?
Yeah, I agree with that, Michael. And I want to say that, $8,000 to $10,000 may sound like a lot, but it's not. YASIP is and CYD program is not a rapid attachment program. As I said before, it's a career pathways program, and it really involves far more inputs to make it work that needs to be paid for. But I can tell you a little something because I get to see all the numbers from across all the partners. the return on investment is cheap. It costs less, meaning that the programs over the last few years managed to raise and leverage about $15 million. But they served about 3,000 people, which came up to about $5,000 per person, right? And so we consider that a pretty good return on a project like this. But the all-in input, what we find out across all the network, that it runs around $8,000 to $10,000 to really make sure that you have the staffing, communication, the resources, and space and time to work on developing and delivering the work.
So, Sunil, did you want to say a word there?
Just very briefly, I certainly agree with Marjorie and Michael, and I'll say, to simplify it, when we pursue federal and state funding, and we're very successful in engaging in that, in those resources. The challenge is those funding sources are quite rigid, and the students that we serve and their needs require more flexibility, and that is a challenging kind of ability to balance those two different diverse funding sources, where the funding source is so rigid that you cannot do certain things that are critical in retaining and serving those students. And the students' needs can only be met by the flexibility and the strong lever that comes from philanthropic funding. And so that is a huge pressure release and a great supporter of these type of initiatives. And so that's what I would like to share.
Okay, great.
And historically, what's been happening is that government workforce money has been leveraged to help HRA and to get people off the rolls, and not for the purpose of developing kids for the workforce. And so it takes on too many masters, and so it dilutes the resource and those that you can support.
And I just wanted to add very quickly also that, this whole concept of our partnership is about workforce investment. It's, it's workforce investment, it's community investment, and the impact that you have on the person that is your client is laterally impacted across their family, and then paying it forward to future generations because of the capacity and the capability that you're giving one person. It has a synergistic multiplying effect, and that's the magnitude of it is, like throwing a pebble in a pond and then having the ripples go out. That's what the impact of these programs. It's not just one job, one person, one life. It's much greater than that.
Exactly.
So thank you all very much. I do believe that we began this with the question of how can we be more employer aligned and work more closely in partnership for young adults. But I believe the lessons go beyond that. We're facing some very difficult times coming up where the kind of resiliency supports are going to be so necessary for workers and for young workers and for young people. And I look forward to ways in which we can grow this model. Mike.
Thank you, Sheila, and thank you everybody for participating. I hope we can do this again. We plan to try and do some things bi-monthly here at CYD just to keep people informed of what's happening. And you're such a great team, and I know people want to hear from you again, because this isn't something that's solved in an hour, but we wanted to keep to that time. We know people are very busy. So thank you for joining us today. Sheila, thank you so much.
Thank you all. Thank you all.
Have a great afternoon. And of course, you can reach out to us if you have additional questions. We'll be glad to share information with folks.
Thank you.
Have a good day.
Thank you.
Bye, everyone.
Bye.
Bye.